Hi, I'm Dr. Larry Weiss. Today we're going to talk about Botox treatment for migraine headaches. What is it? How can it help? How do we use it to dramatically help people who suffer with migraine? My name is Dr. Larry Weiss of Weiss ENT. I'm a board-certified otolaryngologist or ENT doctor. I've been practicing medicine for over 30 years, and during this time, we've helped many people who've been suffering from headaches and facial migraine. Very often, patients come in with symptoms of facial pressure, congestion, stuffy nose, and they think that it's just due to a sinus problem, but very often it is due to migraine, what's called atypical migraine or migraine variant, which can look very much like a sinus problem. But the cause of migraine is very different than a cause of a sinus problem, and the treatment, therefore, is very different. Over the past 30 years, there's been amazing improvements in the treatment of migraine. The initial medicines that were used often would cause queasiness and nausea themselves, but a relative recent option for treatment of migraine is Botox, which was approved by the FDA in 2010. With that said, there's been over a decade of experience with Botox and has proven to be very safe and, very importantly, very effective. Migraines are caused by muscles squeezing specific nerves in our face and scalp, and that squeezing of the muscle by the muscle is triggering the nerve to send impulses to the brain. Botox works by preventing those muscles from squeezing the nerve and eliminates the pathway triggering migraine. Botox significantly decreases the intensity, duration, and frequency of those suffering from what's called chronic migraine. How do we determine if Botox is a proper treatment for an individual suffering from migraine? First of all, we have a lengthy discussion with our patient just to make sure that their history fits the criteria for migraine. And then we do a specific examination, which includes looking inside the nose with a small telescope. And then we also examine the nerves that are involved in the migraine pathway. How do we know if Botox is right for you? Well, first of all, there are specific criteria for somebody to be given Botox for migraine. Their migraine has to be considered chronic, which is defined as symptoms that have been going on for at least 3 months. They happen at least 15 days a month, and they last at least 4 hours. In addition, the individual has to have been tried on some of the older medications like Imitrex or sumatriptan and Relpax, sometimes something called propranolol. And if that person hasn't responded well, that's when usually we will consider Botox for the treatment of their chronic migraine, and usually that's when the insurance companies will actually cover the expense of the Botox. If the decision is made to proceed with Botox for the treatment of migraine, the individual comes in and we figure out the exact nerves that are involved in that individual's migraine syndrome. And with the Botox, we're injecting the muscles that are surrounding those nerves. And what Botox is doing is it prevents those muscles surrounding the nerves from squeezing the nerves, and that's eliminating the migraine pathway. The procedure takes about 10 minutes to do. It doesn't require any pain medicine or anesthetic. Botox does not work immediately. It usually takes about 4 days for it to kick in and for the individual to realize the benefit of it. It is also not a long-term cure. The benefits of Botox usually wear off by the 12th week after the initial administration, and so people do come in about every 12 weeks for a repeat injection. For the vast majority of our patients who have undergone Botox injections, they've recognized a marked improvement in the quality of their life. They're able to focus more on their life and what they want to do rather than having to focus on the significant severe symptoms of migraine. Again, it's super important to get the right diagnosis for what's causing your symptoms. Is it a sinus problem or is it migraine? For those people who undergo Botox treatment for chronic migraine, those individuals recognize a great improvement in the quality of their life. For Weiss ENT, I'm Dr. Larry Weiss. Thank you for watching.